let's move on to calcifications. Calcification in the cone beam breast CT usually appears as bright specks in the image. The calcification usually is much brighter than they show up in the mammography. This is a case that was a calcification. Again, this is a contrast case, actually. I'll introduce the contrast part later. If we go back to the pre-contrast image of the breast, you can see that the this 37-year-old patient has a calcification group in this lower outer quadrant. The group measures about 3 millimeter and by 8 millimeter in its size. And there's a multiple, if we zoom in a little bit, there's a multiple pleomorphic microcalcifications in this small group. At this stage, doctor would likely to have made the decision to proceed to the next step because they see this cluster of calcifications and the multiple microcalcifications in this group. And if we bring up the contrast case, the contrast image of the same case, you can see that the left is a pre-contrast, the right is post-contrast. There's barely any enhancement in the breast. This provides a little bit more information to the extent of the disease. Usually that by seeing there's no enhancement, we may say, or we may have the idea that there's no vessel development around this lesion, so that it provides additional information to stage this lesion. And to compare, we bring up the MR of the same breast. If we look at the left breast, and we scroll through, you can not pick up any enhancement in this breast. MR report of this case came back negative because MR could not pick up any enhancement. As we see in KBCT, there's no enhancement. No, it's in the earlier stage, and MR could not detect any calcifications. So for this specific case, the KBCT detects the lesion while MR could not. The pathology result of this case is confirmed to be DCIS.